Thanks so much. My name is Steve Chai. I'm the Chief Medical Officer for the Center on Medicaid and CHIP. Great to be here with you, and just fantastic panel. I love hearing these stories about how we're using data. I think for myself, it's this issue of how do we think about, and I think the theme of the day is right, how do we think about innovating for the underserved? How do we think about linking those services? And I think those last two speakers in particular hit upon this theme. It reminds me of, I'm still a primary care doc. I see patients in a homeless shelter. A few years ago, I saw a patient, GSW, gunshot wound, in a wheelchair bound, was discharged from the hospital because he had a clot in his lungs. So it's a guy who really needs his anticoagulants. He had seen, I think, 3 or maybe even 4 case managers in the last 2 days, and nobody actually making sure he got the meds that he needed to make sure the clot doesn't get worse in his lungs, right? So I tell this story because it's 2 things. Number one, we have a whole lot of state and federal resources paying for case management, and we're not getting our value out of it, right? And so when we think about what our challenge is within the Medicaid space, when we think about what we're trying to do under Medicaid, it's not just about how do we think about, and my job is primarily to think about delivery reform and payment reform for Medicaid. And it's not just how do we think about linking the hospital and the clinic and the home health agency, which I think we've gotten a lot of. We've gotten pretty good at this in the last few years, and this has been generation 1. And I think one of your slides, I think I have a slide just like it, talking about we can't just think about the linkages between our health agencies. It's got to involve how we're thinking about housing, about correctional facilities, about food. And so when we think about how do we link all these together, it comes back to a data solution. So here I am at an open data event, and the first thing I just want to get out of the way is that we don't have data particularly, right? So let's get that awkwardness out of the way first up top. But I want to talk to you about this because I want to sketch out a vision for what the future might look like and where we'd like to go. Medicaid, as many of you know, we are 68 million now, nearing $500 billion in spending across the country, and growing with each year with more and more states taking up on our option to expand. And so thinking about what this means in terms of that vast population, and in particular, the theme of how do we serve this population better by linking services is critical to us. Skip the slide here. All right, so let me just start real quick with in terms of thinking about what is the first piece is really thinking about what we're trying to do under delivery reform. And the Secretary has outlined a vision for the department in terms of how we're thinking about value-based purchasing and innovating. And she points to 3 pieces in particular. She talks about our need to have better incentives. And so we need to give better incentives for care. How we paying for care matters. And I think we actually are starting to do that, right? And I think a lot of our state partners are starting to do that. We are changing the way we pay for care. But these other 2 pieces that she talked about, I think, are really mission critical right now. The second piece is we need to change the way we're delivering care. It's not just enough to change where the cheese is in the maze and expect people to find it. We need to figure out what does that new pathway look like under Medicaid, and what does that care delivery system look like under Medicaid. And the third thing she talks about is the need to support data and quality information. How do we have that information, that view that helps all of us have an understanding of whether we're achieving our goals here? So, okay, so just one quick snapshot in terms of how Medicaid is using data today. And I think that this is partly trying to get at a sense of what we're trying to do about our data right now. And this isn't CMS for the most part, but I want to give a snapshot of what we're hearing around the country in terms of what people are doing, people like particular the last 2 speakers. So first, we're trying to think about how do we deliver better care? How do we think about providing better care? So I think you heard a little bit about, I think what we're calling colloquially is this idea of the integrators. How do we think about those services like those last 2 speakers that are really trying to connect the services for our beneficiaries? But it's also about how do we think about identifying service delivery. So I think about Washington State, and what they've done in the ER is to connect some of the social services databases in the ER in real time, in particular some of the prescription drug uses and correctional systems databases, so that the ER docs have a sense of what that patient actually needs. And so they know that, for instance, if this is their 6th visit to the ER looking for pain meds, right? And so you think about that data system and the ability to deliver better care for our beneficiaries. It's fueled by that technology. I think many of you have heard of things like Text for Baby. People have heard about that. So the kind of ways, a lot of our beneficiaries don't have internet at home. Most of them have a smartphone. So trying to leverage that capacity in terms of thinking about that as well. The second is helping us understand what's going on with our beneficiaries. And again, I think about that Washington State example where they've integrated the correctional systems data and created a better predictive algorithm for identifying next year's high utilizers, identifying who's going to need our services before they're actually using them, and identifying the needs of these beneficiaries, identifying what they need in real time in terms of what we're trying to do for that. And then finally, how we're trying to pay for better for value in terms of thinking about how do we leverage these claims data systems to generate quality metrics and all that. So the future Medicaid data, I'll just leave it on that first bullet because I know I'm running on time and I think I'm the only one running over here. I was amazed. A panel of federal speakers, everyone keeping to their 5 minutes. It's remarkable. So I want to try and hold to that as well. But the only one I wanted to flash is that first bullet, which is called the Transform Medicaid Statistical Information Services. And I highlight this one because, as I said at the top, we don't have data. We will soon. So under this system that is mandated by the ACA for all of our Medicaid beneficiaries, our Medicaid programs, to be providing unified data to the feds in terms of under this new system, we are about to enter into a new era for the Medicaid program, which is actually having an understanding of what happens in our program. My first day on the job as Chief Medical Officer, first thing I did was I asked for a run of top 10 diagnoses by frequency and expenditures, and essentially the short answer was, yeah, I couldn't get that. We have proxies for it, and I sort of struggled and gotten the intel we need, but it was a remarkable answer for me day one into the program. We will get there with the Medicaid Statistical Information Services, and so I want you all to be thinking about, as we think about how do we translate that in the kinds of uses that we're using now, and as we think about creating public use data files out of that, what do you all need from us? What do you all need from that data set to look like in terms of functionalities, in terms of what we need to do to help us on our mission altogether? Let me just stop there, and thank you so much.